Hi, welcome back to Girl Talk. We're filming today, as you may have guessed, at America's Best Flowers. We're going to be chatting with those folks later in the show about houseplants. Right now, we want you to maybe remember or meet Julie Lombardo. She's with Capital Physical Therapy, and we're so pleased to talk to you today.
Thanks, appreciate it.
Yeah, thanks for coming back. Now, you've been on our show before, but I want to make sure we kind of touch a little bit on some of the basics, like what is physical therapy, and kind of remind viewers how it works.
Yeah, sure. So as physical therapists, we are movement specialists. So I like to tell people, if something in your body isn't moving correctly, or if you have pain when you move, that's where a physical therapist can help you.
That's great.
And then who would this be for?
Yeah, okay. So I've said it in the past too, that I think there's, with physical therapy, there's a misconception that it's only possibly for athletes, but we see everything from the young kid who sprained his ankle on the basketball court, all the way up to the senior who has had a joint replacement or has gotten weaker and wants to stay in their home, longer, that sort of thing. And in fact, our group is probably about 25 to 30% seniors and Medicare, or patients with Medicare insurance. Which reminds me, there's been some really great news, a great victory in the last month of a new law that was passed to repeal the therapy cap.
Interesting.
Oh, wow.
That's not something I know a lot about, Medicare and the therapy cap in particular. Could you tell us a little bit more about that and what that means?
Yeah, so for the past 20 years, I've been a therapist for 20 years now, but for the past 20 years, since the Balanced Budget Act of 1997, people that have Medicare for their insurance have had a limit on the amount of therapy they can receive in a year. So earlier this month, after 20 years of advocacy, they passed another law that no longer limits the amount of therapy that a patient can have during any given year. So this is a really great victory for seniors across our nation. And many times it wasn't a problem, but for too many times a situation would happen where, say, I would see someone early in the year and rehab them, and then something else would happen where they'd need some therapy later in the year, and they wouldn't have any therapy dollars left from Medicare. So they would either have to wait until January of the next year for the therapy dollar amount to reset, or pay cash, which most people cannot do.
Right.
So this has been a really great victory for for seniors across the nation, that they're going to be able to get the therapy when they need it. So we're pretty excited about that.
And I'm sure there's a certain amount of progress that's made, and then if you stop care because you don't have the funding, you kind of probably take a slide back. So that's a really great victory.
Think about the seniors that have had a stroke, and then you're stopping short of full rehab. So we're really glad that we can continue on with them.
That's great news, Julie. Let's talk a little bit for folks who are watching, seniors, our parents, if they're interested in getting an appointment, and this kind of applies to them now with some of the caps being lifted. How do they do that? What's the best way?
Yeah, easy. Another great thing about having Medicare as their insurer is that they have the freedom to go to any clinic that they want to. They can go to a private clinic like ours. They can go to a hospital-based clinic. They're not tied. They get to choose the provider that they would like to see. So that's really great. For us, it's just pick up the phone and call. The other thing that a lot of seniors, I think, don't know is that they don't need a doctor's referral to come and see a physical therapist. We're always allowed to do an evaluation, and we stay in very close contact with the patient's physician for their care.
That was the first thing that came to mind. You kind of assume you need that doctor referral, but not
no,
the
you
case.
don't. No, you don't. Yeah.
So I'm sure people are watching and wanting to know where you located. Can you
sure.
tell us about that?
Yeah, we span across Dane County. So our locations, we have 6 locations across Dane County, all the way from Mount Horeb to Verona. We have 2 in Madison, Wanakee, and Sun Prairie. So there's pretty much somewhere across Dane County we're able to be a convenient location for most people.
That's great.
And Julie, we've got a little bit of time left. Is there anything you'd just like to tell viewers at home and remind them?
Yeah, sure. So I think that sometimes people get nervous, or they're not sure if they're appropriate for therapy. We always welcome phone calls. If someone wants to call and talk directly with the therapist, we very much welcome those phone conversations.
Wow, that's just a great peace of mind and being able to do that.
I bet a lot of people could benefit from something like that, even if you haven't been injured or had something catastrophic happen. But we're out of time. We got to go. But you always do so great. Thank you so much, Julie Lombardo with Capital Physical Therapy. We're here at America's Best Flowers. We'll see you after the break.